Hi guys, my name is Dr. Nina. I'm a cosmetic dental surgeon and a facial aesthetic physician. Please make sure to subscribe my channel and just turn the notification bell on so you're not gonna miss any of my videos. So, what is Botox in the frown line? What is Botox in the forehead? Is it worth it? Is it painful? How long does it last? So today we're gonna really dig into those treatments and find out everything about them. So what is Botox? So commonly known as Botox, Botox is actually a toxin. It's called the botulinum toxin. And what it does, the way it works, it basically blocks the release of a specific enzyme called the acetylcholine between the muscle fibers. So by doing so, the muscle fibers don't have the message anymore to contract. And so by doing so, the muscle start to relax. By relaxing, as a consequence of that, all the lines get softer. So Botox was initially used in medicine to treat muscle spasm, but it was found that as a side effect, aesthetically also all the lines were softened as well. So the Botox lasts for about 3 months and then obviously can be repeated if wanted. Is it painful? It's not really painful. Actually, the Botox is perhaps the most painless procedure that we do in aesthetics. I use very, very fine small needles and so that the treatment is virtually painless and it's done in a few minutes. Risks, the bruising, swelling, swelling not really, mainly bruising, sometimes around the eyes, otherwise very, very minimal. I would say in terms of risk, perhaps the major risk is allergic reaction, very, very rare. And otherwise, in terms of topical complication, it can be a drop of the brows, or if we inject too much to get too frozen. But again, it's all about how much we inject, where we inject, so all down to obviously experience of the injector, anatomy, knowledge, etc. So let's go and meet our model. Okay, so we've got today our lovely model Darcy. So she just had lip fillers done in the past, but no any other treatments. Her main complaint today, what she is really would like to address, is the we call it the frown line, so the number 11 that is appearing between her eyebrows. So there's, in terms of the Botox injections, there's no numbing required. So I'm just gonna go and analyze her face so I know exactly what to inject. So if you can just frown for me, really angry, that's perfect. So she's got really strong frowning muscle, so it would be great when the Botox kicks in, these muscle contraction will get reduced, and so these lines will get soft and also will work also as prevention as well. Lift your brows all the way up for me, a tiny bit in the forehead, making sure this muscle won't compensate, because sometimes if we inject just in a frown, then this muscle want to activate more and then she can develop further lines. My suggestion is, if we do some preventative Botox into your frown, yes, and a little bit in the forehead just to make sure it looks like natural. And a big smile and relax, perfect. Lovely. I'm going to start with the Botox. So as I mentioned, virtually painless, tiny little injections, so you're nice and comfortable. So when you're ready, just a small sharp scratch, that's it. You okay?
Very okay.
Good, lovely. Perfect. So as you can see, she's extremely comfortable and literally really quick treatment. So tiny bit in the forehead coming. Lovely, doing really well. Really good patient today. Lovely, that's all done. So Botox, as you can see, it's literally done in minutes.
Can't feel it.
Right, exactly. It's virtually painless. So now very important is the aftercare. So in terms of the Botox injections, she cannot put any makeup on or any kind of cream for 2 days after injections. So because 2 days, 48 hours, it's the time that the toxin takes to go into the fibers of the muscle. So literally for 48 hours she can't do anything on this area here. And also for 2 days after injections, we suggest not to do sport, exercise, not drink any alcohol, just to prevent any movement of the toxin. The effects will start to show very slowly between 3 and 5 days, but it will take a good full 2 weeks before she can see the full results. So she may experience a bit of headache tonight because it's the first time that she has Botox, and that's totally normal. Normally all my patients, none of them actually needs any painkillers, but she's obviously welcome to take them if she wants to, except the aspirin. So you can take ibuprofen or Nurofen on a full stomach, or some paracetamol. That's all been done.
Thank you.
So I injected some Botox. It was mainly like a prevention treatment. So she was very, very young, so obviously she didn't have any static lines yet. It was mainly just to relax the muscles in a very preventative way. So the way I like to do it is to do, as we call it, a micro Botox or baby Botox, so very, very small amounts, which means she'll still have movement, but everything will just get softer and it will prevent for the lines to get any deeper. So as you've seen, the whole treatment from start to finish has taken not even half an hour. And the patient was very, very comfortable. Thank you so much for watching, guys. Please don't forget to like the video. If you have any questions, just pop them in the comments box below. And also please don't forget to follow me on my other social media channels. If you follow me on Instagram, please let me know that you're coming from YouTube, and vice versa. It'll be lovely to know where you found me first. And also don't forget to check all the skincare tips, the beauty myth that I am talking about on Instagram and Facebook as well. So thanks so much for watching, guys, and again, I would love to see you at the clinic if you're considering any sort of treatments. Otherwise, thanks for watching. I'll see you soon.